Of huge concern, because if the L strain of the COVID-19, which is the deadliest strain, has indeed struck in Ahmedabad and in Indore, that could create problems. But what could those problems be? What is our best strategy to deal with this? For perspective on this, I'm joined on this broadcast by Dr. Ashish Jha. He's the director of the Harvard Health Institute. Dr. Jaiprakash Mullayal is one of India's foremost epidemiologists, former principal of the Christian Medical College. And for a perspective on the modelling that's just happened, I'm joined by Dr. Santosh Ansumuli. He is a professor at the Jawaharlal Nehru Center for Advanced Scientific Research. So, Dr. Jha, welcome to you first in Boston. Can you explain, because you've been looking at L versus S world over, how problematic is this for India that in Indore and in Ahmedabad, local officials believe, even though the Pune National Virology Laboratory hasn't confirmed this, that they are now dealing with the L strain of the virus?
Yeah. So Rahul, thanks for having me back. So there are many strains of this virus. L and S are the ones that we identified early as two kind of dominant ones, and there is some evidence that the L strain is more deadly and, as your reporter said, spreads more quickly. We don't totally understand why some strains seem to hit certain areas more than others. We've seen this in the US. There's some evidence that a deadlier strain might have hit New York than the west coast of the United States. And it may just be an evolutionary thing. And so whether different strains are hitting different parts of India, I think we still need to sort out. But certainly, that is a concern, and to the extent that that's causing higher mortality.
Now that we've seen what happened in New York, we've seen what happened in Wuhan, because in Shanghai and Beijing, apparently it was the S strain, in Wuhan it was the L strain. We've seen also what happened in Italy. What, according to you, Dr. Jha, are the best policy maneuvers India can make at this moment in these states where people would naturally be very concerned about the L strain running havoc like it did in New York and in Italy? Yeah,
so first of all, a couple of things. I mean, we don't know that treatments are going to be any different for these two strains. We don't know that a vaccine that we might develop for one strain won't work for the other. And my guess is that it will. So I think, first of all, people need to know that the things we've been doing, the looking for a vaccine, working on therapies, should work for both of them. Obviously, if you have a deadlier form of the disease happening in your community, it means more aggressive social distancing, more interest and focus on trying to do testing and isolation. All of those policies have to be done much more vigorously, because those are right now the only tools we have for preventing the spread of this disease.
What's your sense of what India should do post the 3rd of May? We're hearing chief ministers, bureaucrats come up with their perspective, sitting where you are, looking at the global picture. What would your post 3rd May, when the second phase of the lockdown ends, strategy be?
Yeah, so, you know, the lockdown, which I have said to you before, I supported, I think it was a good policy, has been, of course, enormously expensive. It's been costly in terms of starvation, people losing livelihoods, people dying. So I think it is time to be very data-driven in areas with low number of cases and good testing capacity. I think you can begin to relax some of the restrictions.
But there are no places with good testing capacity. We tried to build testing capacity by importing these rapid testing kits from China. That didn't work out well. Most of those kits don't work, and now the ICMR has said don't use these kits. So testing capacity is a no-go.
I know. We got to keep working on it, right? This is not a yes or no. You've got to keep working on testing capacity. But also, we can't wait until testing capacity is fully up and running. But this has to be, in my mind, the #1 priority of the government, is ramping up testing capacity, because it will let you use evidence and data to know where you can relax the restrictions.
No, sir. Now that's not possible, because the 3rd of May is just a few days away. Testing capacity is taking far longer to augment. Even in the efforts we made, those haven't worked. Come the 3rd of May, should this lockdown be extended, in your view, in the absence of adequate ramping up of testing capacity, or can it be eased or ended?
So I think places where you clearly have hotspots, you should not be easing. In places that don't have hotspots, you can ease, but you have to know you're doing it in the context of not enough testing, so you are not sure. There's no easy answers here. I don't think you can just extend the lockdown indefinitely. The impact on people of India, especially the poor, has been so great that I think some easing of restrictions in those areas makes sense to me.
But the fear that various people like Ian Lipkin had, the moment you ease restrictions, there'll be more intermingling amongst members of society, and then you could have a hockey stick-like rise in the number of infections. So you're back to square one, and all the effort you made in this lockdown, which is what the editor-in-chief of the Lancet Medical Journal told me as well. So all the effort you've made pretty much goes waste.
No, so let me be a little bit more optimistic than that. First of all the effort that has been made has slowed the infection rate down. I think that is valuable. I'm not saying that you ease and have everybody go back to normal. That would be a very bad idea. You still need to keep a certain amount of social distancing in place, no large gatherings, no crowded theaters, some amount of economic activity back, especially in areas where you're not seeing cases. But I agree with the Lancet editor, this is very risky. The only way to have it be low risk is if you have testing. So I don't have a third solution except the government has to ramp up testing. There is no third way out of this.
Dr. Ashish Jha, for taking out time from a very busy schedule, thank you very much. Deeply appreciate.
Thank you.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.